Welcome back from lunch. I hope you had a good lunch. And this afternoon we're going to start off by talking about the medical effects and consequences of methamphetamine abuse and use. Some of you may have seen these pictures before. They're up on the web. There are a lot of pictures like this actually, and it just graphically demonstrates what chronic abuse of methamphetamine might do. Here was an attractive young lady on the left, and after 2.5 years of heavy-duty meth use, the same person appears on the right. It really it takes a toll, as you can see, in dramatic fashion. And we're going to go through some of the health effects of methamphetamine, including the acute effects, the acute toxic effects, as well as some of the chronic effects. So what is methamphetamine? We've learned this morning about how it's manufactured and some of the precursor chemicals. But actually, what does methamphetamine do to you? Well, it's a stimulant. It stimulates the central nervous system, and it's a different drug than heroin, for instance, which is a depressant, or Valium, which is a depressant, or alcohol, for that matter, which is a depressant. I mean, people who are drunk can get excited, but then they tend to become more sedate and pass out, and they lose their coordination. Methamphetamine is a stimulant. It works on neurotransmitters, and it increases the release of several neurotransmitters, including dopamine, norepinephrine, and serotonin. And probably the most important neurotransmitter that methamphetamine works on is dopamine. Now, why do people use methamphetamine? Well, dopamine has an important role in the regulation of pleasure. I mean, what we experience as pleasurable is chemically mediated. We depend on a normal release of various neurotransmitters, particularly dopamine, to experience pleasure, but we can artificially enhance that pleasure with exogenous chemicals by doing drugs. And why do people take drugs after all? People take drugs at least initially, to feel good, to get high, to get that pleasure. After a while, it often leads to an addiction where they may develop very significant withdrawal symptoms if they don't use the drug anymore. And so their ongoing use of the drug may be a combination of factors, including the symptoms of withdrawal from the drug if they don't use it, as well as the desire to get that pleasure. Although when you talk to heavy-duty drug addicts, they tend to always chase that first high, that first time they used methamphetamine, or the first time they used cocaine, or the first time they used heroin. There's nothing quite like it, so they say, and they keep trying to replicate that experience, which becomes more and more difficult to replicate. Now, as I mentioned earlier today, methamphetamine is related to a number of other compounds, and its parent compound is amphetamine, which you can see on the right side. And the only difference between amphetamine and methamphetamine is a methyl group, and this is a methyl group, the CH3. So here you see amphetamine without the methyl group, and methamphetamine with the methyl group, and that's why it's called methamphetamine, methylamphetamine. That's how it gets its name. And it can be taken by a variety of different routes of administration. It can be taken orally. Occasionally, not very commonly, but occasionally methamphetamine is even prescribed, and it's prescribed orally. And you can see the pills are quite small compared to a quarter there. And the onset of action when it's taken orally is usually about 20 to 60 minutes, so it doesn't have its onset immediately. And of course, other drugs are taken orally as well. Talk about prescription drug abuse like OxyContin, that's used orally, and even something like marijuana, while typically smoked, that can also be ingested orally as well. It tends to delay the onset of symptoms or the effects, and the effects tend to be of a longer duration. Now, just like with cocaine, it can also be used intranasally. We tend to think of the cocaine abuser, at least initially, snorting a line of cocaine. And the same thing is true with methamphetamine. Someone's early use of the drug may be through intranasal administration. It can be produced as a powder. Yes, sir. It can be legally prescribed. It's a Schedule II drug, so